Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Well, first off, what can you do before pregnancy that's safe, or what things should you definitely avoid if you're trying to get pregnant?
So I think before I mainly thought about things to avoid. Until you're actually pregnant, you don't necessarily have to change too much in the way of procedures and things like that. I wouldn't be actively trying to get pregnant if you're in the middle of a surgical recovery or a surgical plan. But for me, since I don't have upcoming surgery, I was mainly looking at my skincare regimen and then considering my injectables regimen. And the main ingredient that you should take out of your regimen is going to be tretinoin or prescription Retin-A. And then for those who are not using prescription products, anything containing retinol. So these are topical forms of the drug that's called isotretinoin, but better known as Accutane. And we know that the oral form of that medication is definitely associated with birth defects. So this topical version, certainly less is being absorbed into the body with a topical cream, but definitely not worth chancing it. So if you're planning on getting pregnant, then I recommend converting to a plant-based retinol. The ingredients bakuchiol, and so that helps give you still some of the cell turnover that you get with tretinoin, so you can have that nice glow and smooth skin, but without the risk of birth defects during pregnancy.
That's great to know. Retin-A and Accutane are both prescription drugs. Presumably you'd know a little about it to avoid it if you're trying to get pregnant, but retinol is actually over the counter. So to all the listeners or viewers out there, yes, you want to avoid retinol because you can go to any drugstore or beauty supply store or department store and just buy it.
Yeah. When you look at, and it's, one of the safest things to do is just to take your skincare regimen, and then when you're talking to your OB/GYN or your doctor or your dermatologist or plastic surgeon, just mention, hey, these are the things I'm using, and they can look at the ingredients and tell you that they're safe. There's other ingredients, even like black licorice, things like that in large amounts can be associated with issues. There's one of my favorite moisturizers by Alastin has that. Probably would be fine to be on that the whole time. I mean, it's like you're not like how much of that extract's like actually in your care. But I just really simplified my my regimen during pregnancy, but I just kept it just great. Clinical strength, like antioxidants, simple moisturizer, mineral-based sunscreen. So I didn't have a chemical-based sunscreen, and that just made me feel like my skin was glowing and being treated and undoing free radical damage, but nothing too intense. And I found, probably from all the hormones, that my skins looked really actually nice during pregnancy, so that's been helpful too, which is not always the case.
Yes. And I guess the other thing, because we're both doctors, we know this, but for the non-doctors out there, what we really do not want is anything that gets into the bloodstream that can potentially cross the placenta and hit the fetus bloodstream. So that's what we're worried about, which is why Dr. Hamilton's always focusing on superficial stuff that doesn't get absorbed.
Yes, exactly.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.